Let's talk about the anatomy of the nose just a little bit.
Sure.
We've got a septum. Is that the septum is where in the nose?
So I've got a little diagram because I use this constantly when I'm talking to people in the clinic about it. So the septum is the area in the middle of the nose. It's what divides the left and the right. It's primarily cartilage, but there's a little thin piece of bone that's involved too. So the septum is what divides the two sides. A deviated septum is when that thing has become very crooked, often from trauma.
Does it usually go to one side or the other? Is it usually right-sided or left-sided?
It depends on the injury. It depends on what caused it. Sometimes it's just like a V. It goes over to one side and back, and it will block one side completely. Sometimes it's more S-shaped, so it'll manage to block both sides as it curves backwards and into each side.
When you examine the nose, can you see which way the septum's going?
You can. So one of the things that we use when we're evaluating the nose is a very old, tried and true piece of equipment. This is a nasal speculum. If you ever see somebody using it, it's not a painful thing. It looks kind of funny and sometimes is intimidating. But what I do is I use this to lift up the soft tissues of the nose so that I can see inside, see the septum, see the turbinates, and get a good idea without having to do anything invasive. Just a headlight and a nasal speculum.
Now, you mentioned the word turbinates. What are the turbinates inside the nose? What are they? We've got the septum is in the middle. We've got a hole we breathe through on both sides. What are the turbinates?
The turbinates are these little comma-shaped things that come off the side of the nose. These are normal structures. They're part of our conditioning unit for the air that comes into our lungs, so they're going to warm the air up. When it's cool outside, they're going to moisturize the air, and they're going to be one of the first things that filters the allergens in the air as it comes into our bodies. So we all have turbinates. We need our turbinates. The problem becomes when the turbinates become too big, they can really block the nose.